I put myself strategically in the center of the poster, so you can look. I only have to explain every aspect of the poster. I drew the short end of the straw, so I have to be the one to do the audio visual on this poster presentation for my colleagues and myself. My colleagues are Dr. Michelle Garwick, who worked on this research with me, and Pat Hawkins-Smith, who's finishing her dissertation and has a legit reason for not having time to do the audio visual portion of this. We are, all three of us have long histories of practice as well as teaching nursing, and we've taught and we've taken care for many cognitively impaired people and supported families that were doing that. However, all of us were at a time in life where we became the flip end of that, when we became the daughter, the actual direct caregiver that in need of support. And when we would get together and talk, we would find that there was a lot that we learned from being on the other end of that experience that we didn't really get being the professional caregiver. So we decided maybe we should look into this a little more depth and see if we can come up with ways to help our 20-something students to understand, who maybe aren't where we are yet, how to improve that care, how to get more from providing that care. So like a win-win-win type of situation. That was the point of going into it. The literature review had a lot on caregiver burnout, overwhelmingly negative stuff. And the few that were qualitative or phenomenological were also very overwhelmingly negative themes that were found. What we tended to want to do is let the caregiver frame the experience and then go from there up to see what we could find and what we could do to address and improve. So that's the approach we took. Obviously, this was IRB approved. So the methods you can read on the poster, the methods we did, and the demographic data we got was pretty straightforward. The results, we did mirror some results that we also got from, that we saw in the literature, but the theme that we found that was totally different or new was that the loving and caring experience that folks were doing had an emotional reward rooted in it that was kind of lacking in the literature. Also, it dovetailed, surprisingly, into, which none of us had even looked into, nursing as caring theory. Again, the theory is very in-depth, and we have 5 minutes, 3 to 5 minutes to go over the poster. So if you look in the center of the poster here, you can see where I cited Nursing as Caring, a model for transforming practice. There's a website, nursingascaring.com, which you could go to, which I did go to after the fact when I saw the themes that had lined up, and I was shocked that it just dovetailed really nicely into that theory. Also, if you're interested, this research is going to be published in an article in March, end of March, International Journal of Human Caring, which is the official journal for the International Association for Human Caring. And that's on the, you can find that if you type that in into the internet, you'll be able to find it. And you should be able to find the article if you're interested in more depth about the research. The common theme that dovetailed that we would like to do more with students, we're working on this now, to try to get students to get away from task-oriented to more relational-oriented approach to patients. Understanding that developing a relationship can assist in storytelling with patients and with students, can assist in that job satisfaction that seems to be lacking in today's society. That's very factory oriented, bottom line oriented, to get some of the job satisfaction back. So client interaction, focusing on what matters most to them, not just the task at hand. Taking more time to care intentionally. Doesn't take any more time to do that. And I'll just end with a real brief incident with my dad, where, you know, a nurse would come in and grab his arm and look at his IV and not talk to him, versus, you know, getting eye contact, just having a little conversation about the pirates even or something, and as you're doing the task, and there's satisfaction for the caregiver as well as the care receiver and the families that are seeing the care provision being such high quality, comes with that kind of connection. So really, in a nutshell, that's where we, in 3 to 5 minutes or less, 2 years of work. So again, if you have any questions, burning questions, that you could go to the website or see when it comes out. Thanks. Bye-bye.